I'm Dr. Nick Gates with Commonwealth Orthopedic Centers. I've been here specializing in foot and ankle surgery and foot and ankle care for the past 18 years. Today we're going to talk about young athletes who roll their ankles. Here at the office we treat athletes of all ages, but in particular with the increase in athletic events and activities for younger people, we see more and more ankle injuries in our younger athletes. An ankle sprain is probably the most common injury to occur in all of athletics. It's occurring in younger and younger athletic age populations. The good news about rolling your ankle or suffering an ankle sprain, even in young athletes, is that your prognosis is very good. Your recovery chances are very, very good if the appropriate steps are taken for recovery. In the younger age group, particularly the pre-adolescents, those younger athletes who say are under the age of 14, under the age of 12, some of our 8, 9, and 10-year-old athletes, a rolled ankle in that population truly represents most commonly a small fracture to the growth plate. In younger athletes, when the growth plate is still intact, the typical mechanism of rolling your ankle is more likely to fracture or crack a growth plate in the ankle than it is to tear or stretch a ligament. The tearing and stretching a ligament is truly the definition of an ankle sprain. In our younger athletes, this damage to the growth plate is truly a minor fracture. The good news about this damage is that the prognosis is very, very good. The recovery is very, very good. However, the treatment sometimes is slightly different. When a younger athlete rolls their ankle, they're more likely to spend a short period of time in a cast to protect that growth plate fracture and allow it to heal. As the athletes become a little bit older, the 13, 14, 15, and 16-year-old athletes, that same mechanism of rolling their ankle is more likely to pull or stretch on their ligaments or tear their ligaments and cause an ankle sprain rather than an ankle fracture. In those athletes, while they may spend a short period of time immobilized for pain control, early rehabilitation is typically the key to early recovery. However, we really try to spend some time with those athletes and their families and their athletic trainers, encouraging them and motivating them to go through the rehabilitation process. While that rehab process is sometimes boring and not as exciting as the athletic event that they want to return to, the rehab process is really the key to them safely and as quickly as possible returning to their athletics. Not only does it help them return to their athletics and their sporting events quicker and faster, even more important to that, the rehab process really diminishes the likelihood that they're going to become a chronic ankle sprainer. Elsewhere on this website, you can see videos about how we repair or reconstruct the ligaments on people who end up with chronic ankle sprains. The best way to avoid becoming that patient who requires that surgery is to really motivate yourself or motivate the athletes to go through the rehab process to re-strengthen their ankle, and that helps them get them back on the playing field and lessens their chance of ever requiring a surgery for a chronic ankle sprain. I'm Dr. Nick Gates, ankle surgeon with Commonwealth Orthopedic Centers.